Hello everyone and welcome back. In today's teaching, we're going to be looking at the popliteal fossa, and this fossa is a diamond-shaped depression that is located on the posterior aspects of the knee joint. Now, if you recall, in the upper limb we have the popliteal fossa, right? So in the lower limb we have the popliteal fossa, and this fossa is a diamond-shaped area that is located on the posterior aspects of the knee joint. Now, this fossa serves as a passageway by which vessels and the vascular bundles can pass from the thigh to the leg. Now, just like every other important landmarks in the body, it has borders. It has a superior border and an inferior border. Now, this superior border is now divided into a superior medial aspect, a superior lateral aspect, while the inferior border is also divided into an inferior medial aspect and also an inferior lateral aspects. So let's check this diagram and the contents to further discuss these borders. Now, the superomedial border of the popliteal fossa is formed by the semimembranosus muscle. The superolateral border is by the biceps femoris muscle. The inferomedial aspect is by the gastrocnemius muscle, the medial head, and the inferolateral border of the popliteal fossa is formed by the gastrocnemius muscle, the lateral end. So essentially, the inferior border of the popliteal fossa is formed by the gastrocnemius muscle, depending on the aspects, right? Either the medial or the lateral. So let's check this diagram to explain the borders of the popliteal fossa. So the superomedial aspect, this is the medial aspect. The superomedial aspect is formed by the semimembranosus muscle. This is the muscle labeled in red. Then the superolateral aspect is formed by biceps femoris. So here is the medial, here is the lateral aspect. So the superior, the upper part, superomedial aspect is formed by the semimembranosus muscle, while the superolateral aspect is formed by the biceps femoris. So we already established that the inferior aspects of the popliteal fossa is formed by the gastrocnemius muscle. So this inferomedial aspect is by the gastrocnemius muscle, the medial head, because the gastrocnemius muscle has two heads. It has a medial head and a lateral head. So the inferomedial border of the popliteal fossa is formed by the gastrocnemius muscle, the medial head, while the inferolateral aspect is formed by the lateral head of the gastrocnemius muscle. Now let's move straight to discuss the contents of the popliteal fossa. And just like we said earlier, we said it starts as a passageway by which structures pass from the thigh to the leg. So what are the contents of the popliteal fossa? Number one is the popliteal artery. We have the common fibular nerve, we have the popliteal vein and the tibial vein. And here is a diagram illustrating them. So diagram labeled in red here is the popliteal artery. The one labeled in green here is the common fibular nerve, and the one labeled in blue here is the popliteal vein, while the one in black is the tibia nerve. So once again, the content of the popliteal fossa is the popliteal artery, the common fibular nerve, the popliteal vein, and the tibia vein. So let's go to the clinical relevance. What are the clinical relevance of the popliteal fossa? Now, for the purpose of this class, we're going to be discussing just two of them. The number one is the Baker cyst. Now, the Baker cyst can be referred to as inflammation or swelling of the semimembranosus bursa. Then the second clinical relevance of the popliteal fossa that will be discussed in this class is the popliteal aneurysm. Popliteal aneurysm is the abnormal dilation of the popliteal artery more than 50% of its original diameter. So that is all on the popliteal fossa that I've discussed in this class. The borders, it has superior border, inferior border, superomedial, superolateral, inferomedial, inferolateral. So the gastrocnemius muscle forms the inferior border, the medial, the lateral head, the medial by the semimembranosus, the lateral by the biceps femoris, that's the superior aspect anyway. Then for the contents, popliteal artery, common fibular nerve, popliteal vein, then the tibia nerve. Then for the clinical relevance, we have the Baker cysts and the popliteal aneurysm. So thank you so much for joining the class. See you next class, and don't forget to subscribe to this channel. Thank you so much.